Hello and welcome. My name's Andy Reid. I'm the director of the Sports Thinktank, and today we're joining one of the 29 organisations that have helped us in our 2024 Manifesto project. We were challenged to come up with policy ideas for a new government after the next election, which would probably not have great resource implications. As we all know, the economy and the public finances are in a position where spending is going to be very difficult for the next period. So these individual organisations have come together. We've created the pamphlet, which is available on our website, but we wanted to give each of the contributors a little bit more time to expand on what they're trying to say in their chapter. So let's head over to the next one in this series of this Sports Think Tank 2024 Manifesto. Well, hello and welcome to the latest in the Sports Think Tank podcast series on the 100 Manifesto ideas. I'm delighted today to be welcoming along Hayley and Martin from the Active Partnership Network. I'm going to do the usual, which is to allow them to introduce themselves and also a little bit about their organisations. But today we're really digging into the chapter that both of them have been leading and playing a large part in. So we'll unpack what comes later, but I'm going to go straight over to Hayley to start and just introduce yourself. I know you've been on the podcast before, and we had some rave reviews from some listeners who were listening to us on their runs, but Hayley, probably just worth unpicking who you are, how you've got to where you are. Then I'll do the same with Martin as well, but welcome both of you. Really looking forward to this discussion.
Yeah, hi, thanks Andy. So yes, my name's Hayley Lever and I've been working in Greater Manchester leading GM Moving since 2017. I've worked in the physical activity and sport and sort of policy sector for my whole career in one way, shape or form. I suppose the insignificance of this is the work in Greater Manchester. The role that I moved there for in 2017 was very much around the devolution deal with it, which included health. So the health devolution work has been a part of that work for the last 7 years. And is still a big part of the work today. And also, I'm one of 43 active partnerships that we all work together. So this chapter is very much about the policy from the policy group of the Active Partnership Network as a whole. And we've been doing more and more work together, particularly over the last couple of years, through a national health group where we bring together active partnerships with Sport England, and other kind of national organisations to really move this work forward. So there's a lot to there's a lot to be going on across the country in terms of health and place.
Yeah. It's brilliant. Thanks, Hayley. And Martin, welcome.
Hi, both. Good to see you. I'm Martin. I'm from the Active Partnership in Dorset. And similar to Hayley, we work closely with the other 43 that are spread around the country. I've been there just over 10 years and have a mixed background in commercial and then leisure sectors and all sorts of things. One of the exciting bits that has helped me in my journey in the active partnership role is I ended up chairing a large leisure trust, which gave me a good insight on that delivery side and that sort of hyper local place and the impact that those sorts of community services can have. As an active partnership, we became extremely close to our health colleagues, what are now in the integrated care service. And we've got a lot of staff embedded through that in our county, which has really given us a chance to look at how health can use physical activity to make a difference to people's lives. So it's a particularly interesting area of work for us, and we really enjoy being close to those key partners.
That's brilliant, both, and thank you for that. And probably that leads nicely, that piece you just finished on, Martin, leads in really to, I suppose, your chapter is called Place and Health. So I suppose in a little bit, do you want to pick why, I suppose, in a sense, we've moved into this sort of space? I mean, I obviously know the history of county sports partnerships, became active partnerships, having been involved in that sort of process a little bit over that time. But is it worth just unpicking where that journey has taken us to date and the changes that have taken place in the decade or so that both of you have sort of largely been involved?
Yeah, I can
probably
go.
Because you've probably sort of been really on that journey, haven't you, over that time?
Yeah, so I was involved in the run-up to 2012 with, we had some delivery in Dorset, we had the sailing events in Dorset, and it was really clear that sport was very much the focus of all agendas at that point. And soon after 2012, we sort of reflected on how we'd worked through that period. And what became clear was how close we'd become to unexpected agencies, things like police, emergency services, health, because to deliver at that scale, we needed to have all those partners on board. There was a growing narrative around physical activity being impactful on so many of their agendas, whether that was reducing crime, improving health outcomes, social care services, all those things. And so as a partnership, we made a decision to move our narrative away from purely sport to physical activity, and very much focusing on how physical activity can impact on the bigger issues in society, economy, health, crime, so many it meets. And that journey started soon after the Games and has really taken us forward at pace. And I'm pleased others have, national agencies have joined us on that journey, really.
Yeah, it's interesting, isn't it, Martin? Because I know in Leicestershire we were doing something similar. It hasn't just been an overnight sort of switch, has it? There has been a large number of people moving in that direction. And Hayley, I know you've really been on that journey as well. So and you've moved between partnerships. So how have you found that, and sort of the response from probably other parts of the sector who haven't always kept up? So we've kept sport in the title of this because there is still a sport element, and how that fits in. And as you said in your start of your piece, you covered nearly all of the bits of these chapters.
Yeah, so it was a real journey. We I guess so. I used to work in Derbyshire up to 2017. We'd started on that road really. When I think back then, we had one person who worked on health, and they were commissioned by the public health team in Derbyshire County Council to, deliver walking programmes and services and work with all the local authorities, etc. And that was the same in greater sport, actually. In GM, in the active partnership in Greater Manchester at the time, there was one person whose role it was to look at sort of physical activity, and the rest of the organisation was focused on sport. And so it has been a real shift to a position now where there's some core kind of funded roles and some real strategic leadership around health within GM Moving as an active partnership. Really, that unlocks the whole team and the whole system, and to point ourselves in a direction of addressing health inequalities through movement, physical activity and sport. And in terms of the language of it, I guess the real sort of catalyst that gave us confidence that continuing to just talk about sport and physical activity was getting in the way of the work was two things really. One, we did some research with Britain Thinks around 2018 that with less active and inactive people, that just screamed out at you that the more, if we continue to use the language of sport and exercise when we're trying to address inactivity, we were becoming part of the problem. And that was also I was experiencing the first few years in my work at Manchester, where all the doors were open, if you like, into the health system, into the what is now the ICP. And when I got into those rooms with health professionals, I had to find language that opened up their sort of sense of belief and emotional connection to this agenda. And it was a real sort of experimentation. Trying different questions to unlock a conversation, whether it was with GPs and primary care or whether it was in cancer services or whatever. And it just became really obvious that actually the wider the lens that you could take with the language and asking people just to get them into it, how does movement to you and your work, or to you and your colleagues, or to you and your patients, depending on the context, just allowed people to really connect with it. And then sport is when you get into the work, sport is a really, really important part of that. And the data shows that sport's a really significant part of how people get their physical activity minutes in active lives data terms. But the language of movement very much allows everyone to join in, which is what a movement for movement is all about. And sorry, the third thing that was significant in that was work we did with Nikki Hawkins around framing and narrative, which again, when someone comes in from outside of your world and looks at your words and goes, well, these words, if that's what you're trying to achieve, have you thought about framing it differently? It just unlocks so much more potential for people to be a part of it.
Yeah. No, and in a different guise, I'm really into framing. With my interest in politics and stuff, it's massively important, and a lot is spent trying to get frame sort of arguments and language in particular. So I really get that, and that sort of leads, I suppose, in a little bit. So probably just wanted to explore slightly in reverse to your chapter, is the sort of starts with the where are we now, before we sort of dive into some of the practical sort of suggestions. And I know probably a lot of people have seen the Sport England Active Lives sort of data and survey, and we've seen some of the shift towards sort of place-based and looking at some of those areas where there is greatest need. But what does it look like for those people, Hayley, that you've just sort of described, and Martin, for those who are least active? You know, what does the system look like to them, and the practical examples that you've both probably been working on to really make the system work for people who are just totally disengaged from what we had before. Exactly what you said, Martin. 2012 was a big moment for a lot of people, but actually totally disconnected many people from what we had on offer as a consequence. So either of you really, I suppose, go back to you, Martin, because of that systems approach, you know, and you have had a bit of experience in that leisure sector side as well, so that we can talk a little bit about the pivots to health as all part of that picture.
So I'm trying to think of a good example for you, Andy, but a good example is something we've been working on for a couple of years. We've got 2 mass outpatient clinics in Dorset, which get about 20,000 people each a year through. And when people enter those buildings, there used to be a sort of board with a few posters on that said, you know, stop smoking and move a bit more, eat better, that sort of stuff. And really, they weren't making much difference. Those that were sort of minded to be involved in that would pick a leaflet up. Other than that, it didn't get very far. So what we've done is we've worked very closely with the clinicians, and we've put wellbeing advisors now in the multidisciplinary team. So at every appointment, a patient meets not only with their lead clinician, they meet with somebody who's going to help them with those lifestyle changes. And so for people that are disengaged, it's finding the activities and the language and the opportunities that motivate them to think, I might do something different. And doing that when they're in a clinical setting, often they do listen to what their doctor's advising. And so bringing them at that moment into an opportunity to find something that they could be interested in doing is game changing, as opposed to them having to do all the legwork themselves and really starting from a position of little motivation. They transform into some of the biggest advocates for activity because it's part of their healthcare journey. So I think it's the right advice at the right time from the right person in the right place, you know, and all of those factors needed to get those people that activity hasn't been their norm to change that behaviour.
Yeah. I think we've all been there, haven't we, sitting staring at those posters. We've been in a hospital, spent a lot of time over the last 12 months in and out of hospitals for other reasons, and they're all there, but don't think I've ever really responded to one or done anything with it. Hayley, that's a great example of people who are in the system, but I suppose a lot of our work is for those who are just, I don't like the word disengaged, but I mean, because we've just not engaged them, have we? But the rest of the system, and actually that whole piece around active design and active environment is important, isn't it? Because there'll be lots of people who we want to move but aren't even actually in any of our systems. They're not in the healthcare system, not in education, they're not elsewhere, they're just in society, and it's reaching those, isn't it, that I think probably is the biggest challenge we've all faced.
Yeah, I think this sort of overarching goal here is to design movement back into life. Because we all live and we all interact with, you know, very many influences on, either it is the way that public transport runs or the way it is our places and spaces are designed, etc., to the things that you were just talking about then. So that's a massive part of the picture when it comes to, you know, supporting active lives for all and addressing inequalities and you know, and groups and communities for whom the conditions are just not set in the way that they are for others. So the gap, you know, the kind of inequalities and the gap is also determined by the environment and the kind of commercial and influences around the where we live. I suppose and that's why place and the context of place is so important in this. Because there are, you know, there are disproportionate influences that holding people back in certain places and communities. And then the other bit, I think, just to build on what Martin was saying, what came to mind, and what you were saying there, Martin, is about how, and it speaks to some of the kind of recommendations in the chapter, really, is that we know that currently you can interact with the system and you won't even have a conversation about how much you're moving. And, you know, and I know this, my daughter's training to be a midwife and she's 1.5 years into her training and nobody has yet talked to her about how you go about that. Now, that is not a criticism of, you know, where she is or the course she's on or anything. It's just the way it is in the system at the moment, in the health system. So the And one of the things that we have found, and there's some brilliant national work now around consensus statement that unlocks a different set of conditions. Imagine a world where every time you interacted with a healthcare professional, social worker, whatever it, teacher, whatever, there is this sort of very natural, non-judgmental conversation around, how much are we moving? How do we? And I think the physical literacy work that's going on at the moment is key to so where do we help people find meaning and purpose and enjoyment in movement? Because it has in the past been quite blamey, and it's all about, well, where to find the willpower and the motivation. So there's two things really. One is how do we create the conditions in which moving becomes a normal part of everyday life, because it's the way society operates. And then the other bit is how do we come from a much more supportive, appreciative position and how do we help the people? So the clinicians who are having these conversations, what we heard over and over again was that GPs and clinicians, one, didn't have a particularly positive relationship, sense of meaning and enjoyment themselves, and their worlds aren't designed to be active. And then the way of having a conversation, there's some great work going on around the kinds of conversations and how you can unlock that. And the great thing is you're supporting people to do something really positive. And there's such a deeper understanding now around behaviour change that's really helpful in the context of the wider system change that's needed. So it's like not stop smoking, it's start, how do you move a bit more? So all the work going on around the healthcare professional side and supporting their well-being, as well as their ability to have conversations and support people is key to this.
Yeah, yeah. And what sometimes things spring to mind I hadn't thought of before, but again, increasingly working with the NHS and other sort of services, I just wonder how much of a challenge is the increasing digital interaction between a patient or an individual and some of these services. I'm just trying to think through my last few months of not really seeing that many people or anybody on the telephone. So you're giving examples of where people are in settings where there is the opportunity to do that. And I just wonder if we might not have the answer actually, but sometimes things just spring into mind and thinking, oh, how are we going to work with that? Because I've got elderly parents who find it very difficult to interact with a lot of services because almost everything is online on an app. And I'm increasingly finding a group of people who are marginalised from society because they're not that tech savvy, and I just wonder if that's something we need to take on board as well. So it might be just a question without an answer at this stage, but if either of you have thought of that, more than happy to chip in.
Andy, if it's helpful, I chair a digital exclusion group locally, so we've got a lot of information about who's excluded, but it is extremely difficult to overcome. The interventions are tough, to bring people into that digital space. And as you say, increasingly the concern is people who aren't in the digital space are getting marginalised more and more. Ironically, it's not always bad news. I try and convince myself because that you're probably supporting your parents regularly on their digital journey, and so you interact with your parents more than you would otherwise. So maybe we can spin it to a more positive state, but definitely in rural settings, digital exclusion, along with lack of public transport and all those other issues that impact, does make it tough for people to access some of those services.
Yes, I've renamed my myself IT support in the family WhatsApp group. For those very reasons, Martin. So it does actually. In fact, I've had a message just this morning from my father-in-law who needs some help on something. So it does sort of feel a little bit like that. But it's an important point, isn't it? This goes back to that system stuff, Hayley, that I know you always talk about. It's actually all of these things are important in their own way for particular groups of people at particular times, and things like rural transport, Martin, particularly where I live, is just an enormous issue. You're not getting anywhere over the weekend if you're relying on a bus. So I suppose that takes us into this. Sorry, Hayley. Yeah.
Sorry, I was just going to say. I think the other thing in that is we've focused so far quite a lot on the clinicians, haven't we? And actually, communities and the voluntary and community sector organisations that are a massive part of the fabric of supporting health and wellbeing in its wider sense are huge in this. And then new social prescribers and those kind of roles are key because people are then having more time sort of face to face. The other thing that we've started exploring in all of this is the potential for AI to support this work, because there's no one answer. People are so different. People live their lives very differently. But there's huge potential for things like AI around health coaching, etc., and nudges and conversations digitally as well. So I think digital exclusion is a massive issue to pay attention to, and we also need to take the benefits of what digital is bringing to help reduce the pressures on the system, really.
Yeah, absolutely.
Andy, just one other thing on this,
Yeah.
and I think it links to this chapter about place, is something that we're very conscious of, is some people's place is digital, not actually geographic. And a really good example of that came up through COVID. So through the COVID response, we had locally a number of people who weren't following the COVID rules. And what came clear was that they were often from migrant communities, and they were still getting their public health advice from their original country, so often East Europe. And they were quite mystified why they were breaking our rules, because they were following what they were hearing from where their messaging was coming from. So I think this place idea is really important, and getting people those opportunities locally. But there is also a cohort who are online, and they're getting their information and news and opportunities from there.
Yeah, that's a really important point, and that has all sorts of consequences, doesn't it? Because in that particular case, obviously, it's national perspective, but given online, I've got a son who spends most of the time online, has got friends all over the world. It's that Hitchcock thing, so it is important to be understand, isn't it, that that's where a lot of that information needs to come from, and I suppose that leads a little bit into, so there are people, I think we just started to hint at that, is there people in the system that we can interact with? But I'll go back to probably your top line message, Hayley and Martin, around building movement back into everything. So you don't need people who are interacting with the system, but the environment in which we operate is such that movement is just a natural part of what we do, and that's the overall aim, isn't it? And for me, even though I love sport and gyms and all the rest of it, I'd like it almost to be the point that we don't need those to get us moving, because we have to, I think the phrase is, we've designed movement back into our lives, and we've only spent 50 years taking it out of most people's lives, haven't we? So we haven't we? The rise of the motor car, out of town shopping, all the sort of things that we've designed mean we move less for a variety of reasons. So it will take time to build that back in. But have you seen physical signs of authorities and other people that you're working through in that system that are starting to recognise that and sort of make substantial changes to the way we are doing that? So there are other chapters where people have got some good examples, but you've got a whole network right across the country of people who are at the coalface, as it were, sort of interacting with planning authorities and politicians to design individually at local level, not just the national policy changes. So I'm sure you've probably got
happy to. I mean, that's sort of, I think, again, to reflect on where we've come from, 10 years ago, 15 years ago, that wasn't really a big part of the conversation. If we talked about walking for travel, it didn't count, did it? So, and what's amazing now is that right across the country, we've got active partnerships and many, many, many partners supporting the whole sort of active travel, healthy placemaking and healthy active places. We've got a woman in our team who's an architect who came on a public practice placement, who now works with us on an ongoing basis with the planning authorities, with the placemakers around urban design and so on. Yeah. So that's a huge journey. And I think, as active partnerships, again, if you go back to where we used to focus on sport and physical activity to a degree, to now we're looking at, how we design places and how people interact with place, is just incredible shift. Yeah. And that the national conditions that then support that are key as well.
Yeah, so you need, clearly, a big win would be national planning guidelines and making that shift, but clearly you also need those very practical steps at a local level. And for challenges, there's a big 2,000 house development happening just up the road from us, and actually from an economic development point of view, it would have been dead easy to have ignored the challenging the planners and others to ensure that it was designed with activity at the heart of it. And comes as a bit of a shock to quite a lot of people that you challenge and actually asking them to consider these things when there's an assumption that everybody will have two cars on the front and travel elsewhere by car. So it's just national guidelines and then sort of local influence with people like yourself. I've seen, Martin, you've got similar examples where you're able to have sort of influenced those planning. It's not just planning authorities, but this is the mindset, isn't it, of developers. We need to almost go further up the food chain as well.
It is, Andy, but it's across all services. So I think the journey that we've come on, as Hayley's pointed out, it's a long one and it's been really positive. So we've moved from sort of no understanding of the impact physical activity can have to now general acceptance that it's a really good thing. I think where we're at now is it sits sort of in the nice to do list of priorities, whether that's through planning or adult services, whatever the service is, it's on the list. And the question is, how do we get it up the list so it becomes entrenched and enforceable all the time? And I think a lot of our chapter talks around data and just getting people to talk about it more, because I think that's where the change happens, is that we work with the planners locally. I know a couple of our strategic planners, the first thing they do is start talking about how do we build into the local plan design around physical activity. But a couple of the others, it's further down their list, and maybe environment or aesthetic design and other things are higher up their list. So I think there is a piece to do around capturing those inputs and understanding the difference they make to help that conversation become just that bit higher priority. And as I say, that's in active design, that's really key, and we've done a lot on that front. But essentially it can't rely on people like you reaching out to the local authority planner to say, hold on a minute, before you go forward, we've got to do something. We need those people in those posts to be really confident about embedding active design, developers to include it as a default rather than as a sort of under sufferance add-on. And as I say, you can pick your way across any service, and it is different, but I think the more we can talk about it, and that's that culture of talking about movement, whether it's in education or crime, and there's so many sectors who are interested, but we just need them to have it at the forefront of their minds.
Yeah, I think I'd agree. I think generally the discussion around physical activity and movement has moved a bit, but again, it's trying to get some consistency of level of engagement across those different parts of the system, isn't it? And Hayley, I know you've been particularly working on loads of this across sort of Manchester in particular, so you have to work with people who are probably not 10 years ago wouldn't have been our normal partners, but so what's the reaction, what's the bits around movement and physical activity that you find resonate most for other policymakers to think, well, okay, there's a bit of a shift in my mindset here, I'll respond to that? And again, I take Martin's point, is that will always vary. There'll be some people who want to put different things as a top priority, but how do we get it into the top 3 or 4 things that they automatically sort of think about when doing their work?
Yes, I mean, our kind of evidence and learning shows that it is about belief, and then it's about agency. So it goes back to what I was saying at the beginning, really, about if people, so the language is important. So one of the things that we know is that you could take any other public policy agenda across Greater Manchester, and people moving more would matter to it. So that question of how does moving matter to you and your work? And then it is a question that would unlock a conversation in any room, whether it's planners or housing or adult care. And we did a lot of that during COVID, actually, as we were shaping the GM Moving and Action strategy. In lockdown, we started to ask the question in Zoom calls and Teams calls just to get people engaged and talking, and actually realised that this was a great, simple question. You can have people typing in the chat, you can just get people thinking on a human level. Why does it matter to me, to my community, to my family? And COVID really unlocked a lot of different mindset shifts around that. So we did a deep dive evaluation into the health integration work last year to help shape the plans with the ICP. And belief and agency are the key. So if you can develop belief and emotional reaction and response and a positive feeling around the importance and relationship with moving people, then that sense of agency is, to what extent do they feel able to influence on that agenda? And how do you get to the point where there's like the Venn diagram of how moving matters to the biggest challenges that they're facing. So that's the journey, really. It's unlocking a conversation about how does moving matter to clean air? How does moving matter to NHS waiting lists? How does moving matter to workforce productivity and well-being? And then they want to know, so there's no shortage of belief, then they want to know, well, what's the role I play? What do you want me to do? And how do we unpick that question of what role and contribution can I play to this with a mandate, because I can make it a part of my job. Because you can be a passionate believer in the importance of moving, physical activity or sport, but if it's not in your job, then you're not allowed to spend time on it, are you? So it all sounds very basic, but it is actually really quite simple now that we've given ourselves permission to ask some different questions. And it is that unlocking of conversation and potential and belief and agency that we see all the time just grows the movement and makes it everyone's business.
Yeah. Which is why I always like talking to you, Hayley, because you do make it sound so simple, and that's probably our role, isn't it? Is to actually simplify. Let's be honest. There's a whole set and series of language in each of these different sectors. I've been fortunate over my life to have to work in variety, whether it's housing, sport, physical activity, transport, health, and they've all got its own set of acronyms and sort of cultures that we need to learn. I suppose that's part of the role, isn't it, Martin? Is just sort of like making it simple for other people who've got busy lives doing things in their own channel. And exactly what Hayley's just described is part of that very difficult role, isn't it? Is empowering them to feel ownership and agency of making changes within their own system.
Yeah, I think Hayley summed it up fantastically. So I think at that level,
she always does.
Yeah, I think, as I say, the challenge is sometimes whether it's in when they do manage to include it in their job, somebody's going to want to measure them against the impact that time's having. And one of the things with all things connected to movement and prevention is it's a long journey, and often we see this particularly in health. They need a sort of 12-month return on investment in essence, and it's a much longer journey than that. And so there is a leadership factor to this, and I know Hayley's had some Hayley's been part of the leadership, but there's been some fantastic leadership in Manchester, I think, quite high profile, which has really changed the freedom of, I think, people in lots of jobs to be able to talk about physical activity and include it without necessarily having to demonstrate a budget line saving or something at the other end. And so that is quite key. We're seeing more of it, but it's not as prominent maybe as we'd like to see it.
Yeah. And I suppose that leads on a little bit in terms of, I suppose, the overall stuff that you've got. So there's the movement, but also, close to my heart, in your chapter, talk quite a lot about well-being, and then obviously making that mandatory, having cabinet, and I think well-being impact assessments as part of devolution deals. There are ways of achieving quite a lot of this, and I think I generally get the picture that the well-being debate has really moved on. We know of countries like New Zealand, Norway, Iceland, Sweden. There's a number of countries that have these well-being budgets. They take things from a very different perspective. And I even know in some of our economic development, not totally focused on GDP. There's a much more sort of inclusion, etc. So we're moving in that direction. And I quite like what you're sort of saying in this sort of piece. So do you want to just unpick a little bit what that would look like? Because I think we've moved on from the happiness index, haven't we, to a much better place where we're looking at the whole person around well-being. And I think some of your suggestions are really, really strong here.
Hayley, I guess I suppose it was a tough ask, wasn't it? The brief for these chapters.
Yes. So deliberately.
Initially, they feel like a tough ask to go. It's resource neutral, So it rules out a lot of things. What it does unlock, though, is a sense of that it's about a worldview mindset shift, and then how you design that in to systems and processes. So I think I really enjoyed, in the end, Martin and I sort of wrestling with the question, because it did roll out some stuff, and then it takes you to a space of, actually, let's get upstream of the interventions and the projects and the investments, get upstream of that and change worldview and our hierarchy of values, and then everything would flow from there. So like you say, there's some great examples now of where people are approaching the question in a very different way. And then goes to Martin's point, what would you then measure? What would progress look like? Is a very different set of metrics, if you like, that you would put on that. So designing in well-being as an assessment of what is the impact that this decision or this investment or this programme is going to have on well-being in its wider sense is where we need to be. Because we've seen how that's worked in other areas. I think that's the key thing, is we've got to remember what we've learned from other, global and national challenges, is you have to make it part of systems and processes and design it in. Otherwise you're leaving it to chance to people's own personal belief, aren't you?
Yeah. And do you find that it's sort of embedding itself in other discussions, Martin? I mean, sort of well-being's, again, you sometimes find yourself ahead in the language, isn't it? It's sort of using it quite often, but then still getting critical looks in different settings. But I think it is. And actually, the Green Book, which is probably the Treasury Green Book, there is a well-being sort of supplementary guidance. And I work with civil servants at Cranfield, and when I ask who's heard of the well-being sort of stuff, we get 60 a month, so it's 600 odd a year. Only a very small smattering of hands sort of go up. So sometimes you can make the national change, but it's then embedding it. Are you finding that sort of works at local level as well, Martin? There are some who get it, but there's still quite a journey to go.
Yeah, definitely. There's a journey to go. I think there's a better understanding. I mean, there's some really useful, very practical stuff at a low level. So Sport England's work on changing leisure centres into wellbeing sites is a good narrative, and that seems to have been understood and locally certainly, and I think more broadly people are starting to see that, and that's certainly helpful. I think the in essence comes back to that local leadership piece again, though, Andy, that if you've got somebody who's advocating for it on a regular basis and it forms part of that conversation all the time, that's the transformation. If it's a sort of, oh yes, we've got to think about that, we'll do that in a while, it becomes a much trickier position. But the journey's the right one. We're heading the right way. That well-being is a better measure for people, and I think they can resonate with that better.
Yeah, I've always thought it's quite a long time measuring GDP as an outcome of the nation is just a really inefficient way, and it doesn't speak. Going back to what you're saying, Hayley, around framing, nobody feels better if their life hasn't changed, but national GDP has risen by 0.1%. It's how do they feel, and so that is quite an important sort of part.
Can I just come in on Martin's
point? Yeah, of course.
On Martin's point there, because I think you've touched on something really important there, which if you imagine we've got 43 integrated care partnerships, 43 active partnerships, boundaries are largely similar. What we have in Greater Manchester, the conditions set for, which is key to what Martin just said, is strategic leadership that has deep belief and commitment to this. And so we're not wasting our time every year trying to reprove the case and to argue the case. It's there, and only this week I've had, we're in budget setting periods, and there's massive challenges all over the country in terms of budgets. But the message back in the autumn was, don't spend the whole winter reproving the case. That belief and that you can see that it's heading in the right direction. It's a long journey that we're on, but the sense of this is cemented in strategically into the Greater Manchester system, and then the question is, what do we need to do next? Where do we need to go next? Not should we or shouldn't we invest in this this year? And that's key, because if you imagine if a well-being strategy and a well-being minister at the highest level in nationally could then unlock that potential throughout 43 places across the country. Where we're not then spending all our time measuring, to Martin's point earlier, return on investment of individual interventions. That we're starting with a much bigger lens on it. So it feels important.
Yeah, no, that's crucial.
Sorry, I just think one other thing that does strike me with this around the piece of work across the whole document, but also our chapter and things, is that certainly we find locally movement, and I think nationally too, is relatively non-politicised. So there's a general broad willingness to engage, and the one thing that would be difficult, I think, is if we were fortunate and a wellbeing minister was appointed and some of that stuff that we see as important happened. Is the other point we made was around long-term outcomes and planning, rather than sort of short political cycles and trying to point score and things in that context. So I think there's a danger for the sector that it doesn't move from this sort of very broad church into a sort of bat and ball ping pong between different priorities, wider probably than the physical activity sector. So there is something in there for me around retaining that sort of whole coalition around it, rather than just becoming an item for one particular point to be made.
Yes, that's true. I get that, and in all the work I do, and I'm sure you get this, long-term decision making and some stability is what nearly everybody asks for, whether it's the business sector, our sector, and others. Is just some long-term vision, and stability brings an enormous difference. And I've always felt, sort of sitting inside government sometimes, I mean, probably you will work a lot within local authorities and others, but there was always that piece on the report, what are the financial implications, what are the equal opportunities implications. I always just thought, if we just put what are the physical activity or movement implications of your policy, we just made people reverse. I know it's not brilliant, Hayley, but it's reverse of your sort of what positively could you do. But also, if you just got everyone to stop and think, if I build this out of town shopping centre, what are the implications for physical activity? It would start that conversation, wouldn't it, around well-being and others. So, but I'm glad you enjoyed the challenge of the no cost, because that's both deliberate from we have to think imaginatively, but it's also the reality of where we're at the moment. So again, you just talked about very difficult budget setting. I know we've taken, £500,000, £1 million worth of cuts to the wellbeing budget from local authorities. Locally, it's not a time of growth of this sort of stuff. It's actually having to do more with less finances. So it does make us think a little bit smarter about how we make the system work better for everyone else. So would you want to describe what you smiled and said you enjoyed it? And actually quite a lot of the chapter writers have said that. It's made them stop and think a little bit. But what came out specifically that you felt was good about that challenge?
I think just the opportunity to spend time writing and crafting the narrative, which we can all get behind, if you know what I mean. It's that the sense that it's the moment in time, isn't it? So it's the latest learning and the latest thinking around where we are and where we need to go next. And the honest, I think the questions of what's getting in the way is a really important one. So not to get sucked into negativity, but to be honest about what stands in the way of this currently was a real opportunity as well. So it was it's all stuff that we're thinking and talking about all the time, but it felt really positive to cement it into something, and to do that together on behalf of the 43, and to go, and to work with our health colleagues to check, well, what would you put in? So we bounced in it off, NHS colleagues, etc., to shape and refine the framing of it, to be able to, like a settled account of what we all agree could make a difference here. And there's many, many other things. I mean, it was hard enough to trim it down, isn't it, to that number. So yeah, it was a fascinating process. And even the fact that we've landed on something we can agree on is an indicator of change, isn't it?
Yeah, and I'd say, again, because of the mass variety of different, trying to show the difference from play right through to elite sport and soft power, I was trying to demonstrate the breadth of what this, and this is only a small part of this sector, but that's what we're trying to cover. But I did find there was quite a lot of consensus, and a lot of people could come up with little things and tweaks and changes that, this marginal gain stuff idea is 100 different marginal gains would add up to, shifting the dial a little bit. It wouldn't be perfect. We could all do with a bit of extra money. But if there's not going to be, what can we, as you say, positively do in the meantime on a shared agenda? And I think it's broadly, you'll have seen that most people are heading in the same direction. So I found that quite affirming, and everybody did enjoy the challenge. Martin, I know you've obviously got a small policy working group, so trying to agree everything and get it down, because there's probably 20,000 words you could have put down. So how did you land on these sort of particular pieces? Because it's very good.
Many dissertations could have been written, Andy, on this. I think the thing that having the zero cost element helped with, but I think it resonates across what we've found more broadly, is that to make change, if in essence you're trying to sell something for a cost, so we're saying, spend money on us because we're going to do this, you're in a very large pool of people asking for the same thing. Everybody's got a project or a plan or a product that they think is going to change the world. And so what we found resonated locally, and I think in the policy group as well, was where physical activity is not going in to say we're here for physical activity's sake. What we're doing is trying to find solutions that address wider societal issues. And the zero cost element is another way of framing the same sort of approach, saying that we're not here for your money. What we've got is some ideas that might help you solve your problems, which might be reducing waiting lists in this chapter's case, or better outcomes when you leave hospital, or whatever the things may be. And I think once the group think in that terms about what can physical activity do for other bigger issues, and cost drifts away, because you're not saying pay for a load of activity, you're saying just change the way you address your pathway, or the way that you speak to patients, or the way that clinicians are trained, or how they interact, and I think that was met positively. Ironically, we, as the policy group, we did the work, and then we shared it with the full network. And to be honest, Hayley, I was expecting a backlash from, because the 43 have got some fairly outspoken folks in there.
I think I know which ones you mean, Martin.
You may have worked closely with a couple of them, Andy. But I was really pleased that generally the feedback was really positive. There wasn't a sort of outlier that somebody said, I couldn't possibly sign up to this. This is a long way away from where our thinking is. I think there was a wide breadth of acceptance that idea of how does physical activity integrate with those other services to improve services as a whole resonated.
Yeah. And that was an important part of the driver for me, Martin. Obviously, fortunately I've sat both sides and sort of been lobbied by different sectors. And I think sometimes we, like a lot, it does come across that we're after your money. And so actually, rightly so, everybody wants a bit more money and they could do something better. But that's why this is a double-edged one, isn't it? There is none. So asking for more money or for other bits of the sector to pay for your current work isn't really going to sort of cut much mustard, if I'm being honest. So I just think it's helping the sector as a whole. I think probably go back to that framing piece, Hayley, is what is it you can build in? Don't need your money, but actually we think we can make a really positive contribution to your outcomes if you just thought in this way slightly differently. So I suppose that's all sort of trying to get to. And we've got 160 ideas rather than 100 originally. Not all were cost neutral, as you probably saw. Some were allowed to sneak through that weren't, so we can measure those. But actually, it did force people to think in a different way, and hopefully, delighted you said, Martin, that others brought in. So just to start to wrap up a little bit, is that of course you can.
Sorry, just something in what you just said there that just reminded me of probably something that we haven't mentioned, which is, we've talked about the last probably 10 years, but for 20 and 30 years, we worked through a delivery model which was about individualised interventions, and it was failing to improve population levels of physical activity or address inequalities. So it's not only, because it's really important that we're not just banging on doors asking for money, but it's also really important because it didn't work when we did. So the evidence is showing now that we're on a better track, and it is about changing culture and mindsets and language and belief. It sounds, some people go, oh, it's fluffy, like how do you measure that? But we are more and more confident, the evidence is pointing to that a whole system, place-based approach is working and is the way forward. And so it's not just stop asking for more money. It's like, no, lift your heads up and think bigger. And actually, I do believe that it might be less effort if we're about changing mindsets. It might actually be easier than constantly, banging on the door for money and delivering programs and interventions. That will flow. But it's I just think that's a really important point, because it's not just about the last 10 years, is it? It's about the last 20 or 30 years that we're really sort of trying to redress the balance.
Yeah, absolutely. And, we have tried a variety, I've been involved in that 30 years, tried a variety of ways of seeing the world. So participation through specific sports, was a big driver. And then, as you say, those debates around active gardening or active walking for work, etc. There was a massive debate of whether that counted or it didn't. And hopefully we've sort of moved beyond that now, is that we recognise all movement. And I've told this story hundreds of times, but, my zone energy points that I get, I can probably lazily run around on a rugby pitch and not get very many, and I've done 3 hours in the garden and got more energy expended as a consequence of moving. So they all count, don't they? That, from my point of view, that's what we're aiming for. And so I suppose just touching on that, Hayley, and sort of probably trying to draw it to close, I suppose it's just we've only touched a little bit really, I suppose, on the enormity of what the active partnerships do, and we've sort of targeted this sort of specific piece, and it's been very good at this wellbeing agenda and movement as a whole. Thanks for listening to the latest podcast. Hopefully you found it helpful and you've gained some insights from our guest. If you have enjoyed it today, it would be really helpful to hit the like button and subscribe wherever you get your podcast from. As always, feel free to pop over to any of our social media channels to comment or ask a question, or sign up to our monthly newsletter at sportsthinktank.com. If you're interested in supporting our work at the Sports Think Tank, again, just head over to the website or drop me an email. Thanks, and see you again next time.